Hey, Facebook family. I hope everyone's well. I know it is just about 9 a.m. in Texas. So, for my Miami and Floridians and East Coasters, 10 a.m. So, you all are just getting settled into work, probably not able to get online right now. Hi, Audrey. Thanks for joining. But for those who can, I just wanted to do a quick impromptu Facebook Live talking about some health topics that I think they have come up, things that I've seen, interesting cases in my practice that I think may be helpful to my friends, family, followers. It's Wednesday, Wellness Wednesday. We usually do this for Road Docs, but I said, hey, why not do it on my page? I don't think I've ever done that before. I do have patients to see today, but this is how I want to kick off my day. My topic for today is Dr. Google, because I find a lot of people, hey, how are you, Sarah, in New Jersey? Awesome. I want to talk about Dr. Google because technology is amazing and people are able to look up things like they weren't before. And a lot of times, I'll have patients come in and they self-diagnose, right? We call that Dr. Google. Hey, Dia, thanks for joining. Hey, Melissa. And that's fine, right? If you want to look things up as a family medicine physician, I encourage it, right? Because it gives us an opportunity to have a conversation. But a lot of times people are so stuck on that diagnosis, they don't want to accept the truth. And so unless you have that medical degree, training, listen to your doctor, okay? So I'm going to give you some examples of things where people thought it was one thing, turned out to be another, or things that we know, oftentimes people think it's one thing and it turns out to be another. And if you're watching and you have a medical question for me, again, my specialty is family medicine, so pretty broad. I can answer on a basic level most medical issues. Feel free to shoot, okay? So Dr. Google, that's our topic. First thing I want to talk about is a patient I saw about 2 years ago, still my patient today, have a great relationship, actually a doctor, and he had a really bad sore throat. And I believe he went to 1 or 2 urgent cares and they diagnosed him with strep throat. And then he came to me, who I am his primary care doctor. I'd seen him a couple times, and I've seen this happen over and over again. So I'm cautioning you all, urgent care is great, but when you don't have a relationship with a doctor, they can only see that small snapshot in time. When you see the same doctor over and over again, that doctor knows your history and it helps to make a diagnosis. So sometimes it's not that the urgent care doctor is bad, they're just looking at a snapshot. It's like if I gave you one puzzle piece and said, now tell me what this puzzle is. There's no way you can know. There's only so much information an urgent care doctor can get from you in the 5 minutes they have to see you while there are 20, 30, 50 other patients waiting in the waiting room, right? Versus me online, telemedicine, or in the office, we're talking 15, 20 minutes. I can really get to the problem. Now back to the patient I'm talking about. Hi, Christian. Hi, Marcia. Hi, Christopher. Thanks for joining in. So he was diagnosed with a sore throat elsewhere, came in to see me. Again, I saw him in the office, but I could have made the same diagnosis from telemedicine because it was based mostly on his history. What I realized is he had a sore throat, but he had a sore throat and a fever, right? He had a lot of other things going on, but it just did not sound like strep to me, right? I've seen strep 1,000 times. I used to work in urgent care, so I know what strep looks like. I'm like, this is not strep. So I started doing my exam. I examined him. The first thing I noticed is his throat is swollen and hot. Okay. Now, if you have strep throat, the pain is on the inside. So why is the outside of his throat swollen and hot, right? And it was clear, it was obvious. And again, urgent care doctors are under a lot of pressure, especially coming up flu season and things like that, to see a lot of people quickly. I don't fault anyone for missing something in those kind of settings. You know, in Jamaica, we have a saying, you know, don't give me a basket, a basket is filled with holes to carry water. And I feel like that's what healthcare is becoming. Doctors are giving baskets, told to see a lot of patients in a short amount of time and not make mistakes. And yes, they will mess up, not because they're bad doctors, but because of the system. The system is what's broken. So fast forward, I do lab work. I know I do not think this is strep. I'm not going to throw another antibiotic at him. Come to find out, he had a thyroid condition. He had his thyroid was overactive, really overactive. I mean, I had never seen thyroid numbers that high. So within 24 hours, I did his labs urgently, got his lab results back, got him treated, got him in touch with the endocrinologist that he still sees today, and was able to solve that problem like that, right? Because I wasn't looking at just one thing in front of me, a sore throat. Now, had he gone to Google and said, I have a sore throat and a fever, oh, you have strep, you know, or a rush doctor, oh, you have strep. But this is why it's very important not to only rely on Dr. Google, but actually to see a doctor. And again, a doctor that you have an ongoing relationship with, in my opinion, always trumps going to urgent care for a quick, fast visit. The next thing I want to talk about, I think is really important, is heartburn, right? A lot of people suffer from heartburn or have nausea. I saw a patient last week who told me, you know, she wanted a refill on her Zofran because she's always nauseous. Okay. I said, first of all, I can't just give you Zofran that you just take all the time because you're always nauseous without figuring out why you're always nauseous. But this is not a knock on urgent care. There's a place for urgent care, time and a place for it. But you go to one of those places and you go from doctor to doctor, doctor hopping, and say, I just want a refill on my Zofran. They're going to say, okay, and give it to you. Meanwhile, as I explained to her, you know, she was saying, well, you know, I've had heartburn and things like that in the past. I'm like, this is not normal. And what worries me about this is that things like heartburn are, hey, love, are a precursor with 10 years or more of inflammation of things like stomach cancer. And unlike prostate cancer, where we check your PSA, breast cancer, where we do a mammogram, there aren't a lot of routine tests that I do that's going to tell me if you have stomach cancer. And I've had a patient in the hospital, 50 years old, who died of stomach cancer, right? So it happens. And for someone to be walking around saying, I'm just getting this routine refill for being nauseous every day of my life, that's not normal. That's a broken system where a patient gets that refilled over and over again without somebody saying, hold up, stop, pump the brakes. What is going on here? I don't treat problems without finding out the underlying cause, okay? So that's one thing, nausea, heartburn. With heartburn, a lot of times people have heartburn and they just assume, okay, spicy food, things like that. But I do want to say, especially for the women watching, that when we get heart problems, it doesn't always present as chest pain. So whenever someone tells me they have heartburn, yes, I can give you the purple pill. I can take care of it. I can tell you how to modify your diet. Hi, Dr. Una. Hi, Jade. But I'm also going to immediately, reflexively start thinking about your heart, right? How old are you? 50 or older. Do you have any medical problems, diabetes, or any high cholesterol, anything that will put you at risk for heart disease? Okay, did anyone in your family have a heart attack, especially at a younger age? If I go through that list, I don't care if you are having just heartburn. I want to make sure this heartburn isn't masking another problem, right? Now, if you come see me in urgent care during flu season, I'm not going through all those steps. I'm not a bad doctor, but I'm working in a system where I have to see 50 or more patients a day. I don't have time to worry about your heart. And I'm saying this because we've gotten to a point where, especially now with telemedicine in the mix, right? I can Google it, then I'm gonna go to urgent care, tell urgent care what I need, or I'm gonna hop on this telemedicine company, this random telemedicine company, clearly not Rodox, right? And they're just gonna give me what I want. And meanwhile, something can be brewing in your body and you don't know it because you haven't established and built a relationship. So for those tuning in, my topic today is Dr. Google, talking about things that people look up online, think they know what's wrong, and come to find out something bigger might be really going on. The next thing I have on my list is shortness of breath. Okay, sometimes people come in short of breath and they're like, I'm overweight, I'm out of shape, doc, that's why I'm short of breath. Make sure it isn't something else going on. Again, cases I've dealt with, practicing, seeing, people who are like, well, I smoke, so that's why I'm always short of breath. But yes, you smoke and you're always short of breath, but has this now progressed from just smoking, shortness of breath, to COPD or potentially lung cancer, right? If you are a smoker and having shortness of breath, it could be your baseline. It could be what you're used to dealing with, or it could be something more. So don't just go based on Google. Get a chest x-ray. You can get a chest x-ray in an urgent care or another setting. But again, I strongly encourage you to have your own doctor, because I heard a story this weekend at the NANI Foundation about someone who had an abnormal mammogram. The system failed. No one notified her of that. And when she had her second mammogram, they're like, yeah, you have progressive cancer. It's progressed from that spot on your mammogram back when. And she's like, oh my God, how could no one call me with those results? A broken system. So you go get your x-ray at an urgent care, and your x-ray happens to be that x-ray that slips through the crack. Yeah, your family can sue, but you might be dead by then. Have an established relationship with a doctor, whether virtually or in an office, that your results will not be overlooked, okay? Next thing, fatigue. A lot of people are tired. America is stressful. I love it. I'm a patriotic citizen, but living here, the demands, the work hours, work 8 hours, pick up your child, come home, cook dinner, find time to work out. It is exhausting. So being that it's exhausting, when people feel tired, you're just like, I'm tired because I work a lot. I'm busy. This is the result of living the life I live. But truly, if you're eating a balanced diet, lots of fruit, lots of vegetables. My during the week diet, I don't eat a lot during the day. Try to have a salad at night or some lean protein and veggie. If you do that, and you exercise throughout the day, like when I'm here working from home, middle of the day, I get up, do some jumping jacks, do some sit-ups, get my blood flowing. Same thing. After Chase comes home, do a few jumping jacks, do a few sit-ups. Even if I don't make to the gym, I know that I have done some activity. So if you're active and eating a balanced diet and you're still tired, get some blood work done, right? And it sounds like, duh, Tisha, of course I would do that. But a lot of people, out of fear, denial, or so busy taking care of everybody else, your husband, the kids, whoever it may be, you are not taking care of yourself. You probably have not had blood work done in years. How do I know this? Last year, I polled my doctor friends. We're doctors, right? So we know. We're so smart. There were people who hadn't had a physical in 5 years, 3 years, doctors. So if I know doctors aren't taking care of ourselves, some of you all aren't either. So if you need blood work done, guess what? Ding, ding, ding. You could go to Rodox. We can order the labs for you. You don't have to, let me find a doctor. Oh, next appointment isn't for 8 weeks. By then I might forget, or I lost my job, my insurance gone. Do it today. Don't put it off. Go to Rodox.com. We can order labs for you, because there's so many reasons you can be tired. And I want to call out my men today, because again, this is something that I told a friend for years. I thought that was what was going on, but only recently it actually got diagnosed. Low testosterone, very, very, very common in men over 40, right? And sometimes it can even be a little bit younger. I've seen it younger sometimes. Easy fix, so easy to fix. Affects their energy, affects their mood, affects their ability to function. And quick, I could order those labs and have that problem corrected, right? Not something that most people are comfortable going to urgent care, but if you put in fatigue or tired in Google, Google gonna tell you that you have cancer, right? And that you're dying or something crazy, where what you really need to do. Hi, Carrie Ann, thanks for joining. Hi, Imran. Hi, Leah. We're talking about Dr. Google, right? People going on the internet trying to diagnose themselves and how they may think it's one thing based on Dr. Google, and it could be something completely different. Last thing I'm going to talk about today is mental health, okay? And perhaps this is something that you're Googling things because mental health issues present in many different ways. And let me tell you the ways that I see it most often in my office, you know, and things that I've dealt with myself when I'm overworked, overstressed, and pushing myself too hard, okay? Headaches. People come in, I have a headache every single day. I need a CAT scan, doc. I'm like, cool, I'll order your CAT scan. I know it's going to come back normal because that headache may be coming from somewhere else. Have I ever had an abnormal CAT scan of a patient? Yeah, older patients have strokes, things like that. But young, normal person, you know, a lot of times, 9 times out of 10, it's going to be something else going on. Migraines. What's causing the migraines? Where's the stress coming from? What's going on? People not dealing with the stress, the anxiety, the depression, right? So instead of saying, I'm sad, I'm lonely, I hate my job, you just like let all of that negative energy ball up into you, and your body has to release it somehow. So that somehow becomes chronic headaches or stomach issues, you know, can't figure out what's going on with my stomach. It's upset every day, doc. Can't figure it out. I run every test. I run every lab. We get CAT scans, ultrasounds, boom, everything's normal. So now I'm a bad doctor because I don't have a reason to give you, but you really deep down know the reason, right? Is it the bad marriage? Is it the problems with your kids? Is it the job that you hate, but you refuse to quit and pursue your passion? It could be any of those things. So everything I've discussed with you today, I can help with online through telemedicine. A lot of times I have people say, hey, what do I use a telemedicine visit for? That's what you use it for. If you find this information helpful, share it, because maybe it's not you, but maybe it's somebody else on your timeline today that is suffering, and you could be of help to them. When I was in college, University of Miami, go Canes, we're going to have a great season. I worked in the security office, and I worked overnight. I worked a lot in college. I worked during the day doing fundraising. I worked overnight in the security office. And because I worked in the security office, I would be privy to the incident reports, things that happened on campus overnight. And I was surprised to learn that, like, of the attempted suicides on campus that never made the news, never made the papers, you know, no one on campus knew what was going on. But because I worked at the security office, I saw, thank you, Marcia, those incident reports. And I know a lot of proud parents sent their kids off to college this month. And I cannot imagine the heartbreak of a parent if you find out that your child is suffering on campus. College is wonderful, it's fun, but it's also the first time you're alone. You know, I was in the same city with my family, but I still dealt with, like, wow, this is such a new environment, you know. It was also stressful. So your child probably won't come to you and say, Mom, I'm feeling really sad. I'm afraid of failing. You know, I've met the wrong friends. I've tried some new things. So give them a resource like Rodox to say, if you need help, here's somewhere that you can go get help. Don't worry about telling me why. We'll take care of it. If you need help, here's where you can go. Because the times where they're suffering, the student center probably will be closed, right? If they're intoxicated, yeah, of course, your child's not going to drink. But for those children like me that drank in college, intoxicated, worried if they maybe drank a little bit too much, or, you know, first boyfriend, first love broke their heart. They're feeling like the world has ended. They need someone to talk to. Give them a resource like us that they can go to. So that's my spiel for today for Wellness Wednesdays. I'm Dr. Tisha Rowe. If you made it this far, definitely share. We're 19 minutes in. I'm going to get it wrapped up. Follow me on all social media, Instagram, LinkedIn, Twitter. I just got my name from my YouTube channel, Tisha, Tisha Rowe, Rowe, MD for medical doctor, for those who don't know me. And please feel free to share. This will be available on YouTube as well as my professional page. Few places that telemedicine may be helpful that I could use your help with. Your church, if your church has a health ministry and they're looking for ways to help the members of the congregation, let them know that my company, RoDocs, would love to partner with them. If you live in a apartment complex, we do offer services for apartment complexes. And if you are in college or have a child in college, we partner with colleges and universities to make sure their student body is healthy mentally and physically, and we can take care of a lot of problems from online. So thanks for tuning in. Share, connect with me, and let me know in the comments what topics you want me to talk about next week. Thanks, everyone. Have an amazing day.